So the treatment essentially for most blood cancers is chemotherapy. Some newer agents nowadays have come which are known as targeted therapies. In some cancers, we do have a role for radiation as well. The most important component of treatment again depends on the type of the cancer. In leukemias, for example, the standard of care involves a combination of chemotherapeutic drugs and oral drugs known as steroids. During the chemotherapy, these drugs are used in various combinations and types. Then it includes IV injections, some of which are given over 24 to 48 hours, some of which are given as an injection, as an IV push, and some which are given over 1 to 2 hours. The major advances that have occurred in lymphomas, for example, are newer drugs known as targeted therapies. The most famous drug is known as rituximab. That drug has actually revolutionized the care of CD20 positive lymphomas and has increased not only the response rate but the overall survival as well. Nowadays in Hodgkin's lymphoma, we are having a new agent known as brentuximab, plus we have newer drugs known as immunotherapy, which have shown excellent results in Hodgkin's lymphoma post-transplant. In myeloma, the treatment has moved almost completely away from chemotherapy to targeted therapies. So we have drugs known as bortezomib, carfilzomib, and lenalidomide, which nowadays form the backbone of treatment in multiple myeloma. So again, rather than generalizing and saying this is the treatment for blood cancer, it is important to note that we need to define the type of cancer and then plan the therapy accordingly. In some cancers, especially lymphomas, radiation has an important role to play. If there is any residual tumor left behind, or if the size of the tumor was quite large to begin with, giving radiation at the end of the chemotherapy helps in increasing the survival, helps in increasing the response rate as well.